I am Dr. Esther Achan. I head the Infectious Diseases Clinic at Gulu General Referral Hospital, and it is this clinic that houses the HIV clinic. About follow-up of our PMTCT mothers, first and foremost, we have our PMTCT clinic based at the MCH department, which is the antenatal clinic of the hospital. What happens is when our mothers come in for the first time, we try as best as we can to map them. This is not catered for in the antenatal register. So we have a different book where we take their address step by step so that in the event that they need to be followed up, the directions are clear for anybody and for all. For those that have phone numbers, although this is a very small population, we do take their phone contacts or that of the next of kin. Now what happens is in our routine activities, weekly we have a community linkage team that moves down to the MCH department. And weekly they derive the names of those mothers that did not keep their appointments. Now once they've come up with a list of mothers that didn't keep an appointment, the next week they are planned for so that they can be followed up. What happens is for those that have phone contacts, we do call them and they actually respond. It's been a very good success here because they actually do return. For those that do not have phone contacts or for those that were unable to reach through the available phone contacts, we do the home visits. We visit them using the record of the mapping that we did at their index attendance. We use a motorbike that has been provided through one of our implementing partners, IDI, CSF project. The airtime that we used to call them has also been provided for using another partner, Sustain USAID project, which also allows some little money for the home visits. Here is a small fee for the staff that go on to follow up these mothers. It's just transport and a refreshment for their day activity. However, we've had challenges here with, we believe that even if this is seemingly working well, we believe that there are some other things that could be brought on board that will work very well to enhance follow-up activities of our mothers. The employment of family support groups, an initiative that we are embarking on over the next 3 months, is going to be very key. Because if the patients themselves can identify themselves and follow themselves up, it works better. And also use of VHTs, for example, say expert clients, peer leaders that are identified within the institution. We can use a similar, say, location. If we identify that there's so many mothers from such an area and we identify leaders, this can actually walk door to door and identify them and check on them. And we think this can preserve confidentiality and also openness. So those are the recommendations that I would have in regard to enhancing or boosting follow-up activities of our mothers.